You take a pill to feel better. That seems reasonable. That seems like the responsible thing to do. You trust that little tablet because a doctor recommended it, or because it has been sitting in your medicine cabinet for years, or because millions of other people take the same thing every single day. But what if I told you that the very pill you swallowed this morning to help one problem is quietly creating another problem that could be far more dangerous? What if the medication you trust completely is silently pushing your blood pressure higher and higher each day, while you blame stress or aging or salt intake for numbers that keep climbing no matter what you do? I'm Dr. Rebecca Lawson. I've practiced internal medicine for 22 years, and I specialize in treating patients over 60. What I'm about to share comes from 2 decades of watching patients struggle with blood pressure that refuses to cooperate despite doing everything right. They exercise, they watch their sodium, they take their prescribed blood pressure medications faithfully, and yet their numbers stay stubbornly elevated or even creep upward over time. When I dig into their complete medication list, including everything they buy over the counter, the culprit often becomes painfully clear. Something they never suspected is working against them every single day. By the end of this video, you will know exactly which common medications and supplements can raise your blood pressure, why this effect becomes dramatically more dangerous after age 60, and what conversations you need to have with your doctor immediately. This is not about frightening you away from necessary treatments. This is about giving you information that could finally explain why your blood pressure has been so difficult to control. So please stay with me through this entire video. What you learn here might be the missing piece you have been searching for. Let me start with a patient I will never forget. His name was Douglas. He was 73 years old, a retired firefighter who prided himself on staying active and taking care of his health. Douglas had been managing mild hypertension successfully for nearly a decade with a low-dose medication. His numbers were consistently in the healthy range. His doctor was pleased. Douglas felt great. Then everything changed. Over the course of about 6 months, Douglas noticed his blood pressure creeping upward during home monitoring. 140/90 became 150/95, then 160/100. His physician increased his medication dosage. The numbers barely budged. A second blood pressure drug was added. Still, the readings remained dangerously high. Douglas was frustrated and frightened. He had not changed his diet. He had not stopped exercising. He could not understand what was happening inside his body. When he came to see me for a second opinion, I asked him a question that changed everything. I asked him to tell me about every single pill, tablet, capsule, and supplement he put in his mouth on a regular basis, including things he bought without a prescription, including things that seemed completely harmless. That is when Douglas mentioned the ibuprofen. For the past 8 months, he had been taking 600 milligrams of ibuprofen twice daily for persistent knee pain from an old injury. He never thought to mention it to his cardiologist because it was just ibuprofen. Everyone takes ibuprofen. It is available everywhere without a prescription. How could something so common possibly be causing serious harm? But that innocent-looking anti-inflammatory pill was the saboteur we had been searching for. Here is what most people do not understand about non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and diclofenac. These medications work by blocking enzymes called COX-1 and COX-2. This effectively reduces inflammation and pain, which is exactly what you want when your knee is throbbing or your back is aching. But these same enzymes play a critical role in regulating your cardiovascular system. When you block them, 2 dangerous things happen inside your body. First, your kidneys begin retaining sodium and water. Under normal circumstances, your kidneys carefully regulate fluid balance to keep your blood pressure stable, but NSAIDs interfere with this process, causing your body to hold on to extra fluid. More fluid means more volume in your blood vessels. More volume means higher pressure against your artery walls. For a young person with flexible arteries and a strong heart, this extra strain might be manageable. But for someone over 60 whose arteries have already stiffened with age, this additional pressure can push readings into dangerous territory. Second, NSAIDs reduce the production of substances called prostaglandins that help keep your blood vessels relaxed and open. Without adequate prostaglandins, your blood vessels constrict. Imagine trying to push the same amount of water through a narrower pipe. The pressure increases dramatically. And if you are already taking medication to lower your blood pressure, NSAIDs can partially or even completely block its effectiveness. You might be faithfully taking your blood pressure pills every morning while your afternoon ibuprofen quietly erases their benefit. Douglas stopped the ibuprofen under medical supervision and switched to alternative pain management strategies. Within 3 weeks, his blood pressure dropped by 15 points. Within 2 months, we were able to reduce him back to his original single low-dose blood pressure medication. The problem had never been his heart or his arteries or his lifestyle. The problem had been sitting in his medicine cabinet all along. But NSAIDs are only one category of common medications that can sabotage your blood pressure. Let me tell you about Patricia. She was 68 years old and came to see me in the middle of winter with a frustrating problem. Her blood pressure had been beautifully controlled for years, but for the past month it had been running unusually high despite no changes to her routine. Patricia was meticulous about her health. She tracked her blood pressure daily. She knew something was wrong, but could not identify the cause. When I reviewed her recent history, Patricia mentioned she had been fighting a stubborn cold for several weeks. To manage the congestion, she had been taking an over-the-counter cold medication containing pseudoephedrine. She took it exactly as directed on the package. She had no idea it was silently assaulting her cardiovascular system. Pseudoephedrine and phenylephrine are found in dozens of popular cold and sinus remedies. They work by constricting blood vessels in your nasal passages, which reduces swelling and helps you breathe easier. But here is the critical problem. These drugs do not only affect the blood vessels in your nose, they circulate throughout your entire body, constricting blood vessels everywhere they go. For someone with healthy blood pressure, this might cause a modest temporary increase. For someone over 60, especially someone already managing hypertension, this can trigger a dangerous spike. I have seen patients arrive in emergency rooms with blood pressure readings exceeding 180 over 110 after taking nothing more than standard doses of over-the-counter decongestants. Patricia's body was doing exactly what the medication told it to do. It was constricting blood vessels efficiently and effectively. The consequences were simply unacceptable for someone in her situation. If you are watching this and you have high blood pressure or any cardiovascular condition, I need you to understand something crucial. Before you take any cold or sinus medication, you must check the active ingredients. Look for pseudoephedrine, phenylephrine, or any ingredient ending in ephrine. These are warning signs that the product could raise your blood pressure. Safer alternatives exist. Saline nasal sprays, steam inhalation, and certain antihistamines can provide relief without cardiovascular consequences. But you must be vigilant because these products are marketed heavily and available without any prescription or warning specific to your situation. Before I continue with additional medications you need to know about, I want to ask for your support. Please take a moment to subscribe to this channel and click the notification bell. My mission is to provide clear, actionable health information that empowers you to have better conversations with your doctors and make more informed decisions about your own care. Subscribing helps me continue creating these videos, and please share this with someone you love. Parents, grandparents, friends who manage their blood pressure. A simple share could help someone finally understand why their numbers have been so difficult to control. Now let me tell you about another category that surprises almost everyone. Antidepressants, specifically certain classes of antidepressants that are still widely prescribed. I want to be extremely clear about something before I continue. Depression and anxiety are serious conditions that deserve proper treatment. The worst thing you could do is stop taking a medication that is helping your mental health without careful medical guidance. But you deserve to know that some antidepressants, particularly a class called SNRIs, which includes medications like venlafaxine and duloxetine, can raise blood pressure in some patients. These drugs work by increasing levels of norepinephrine in your brain, which can improve mood and reduce pain. But norepinephrine also affects your cardiovascular system. It can increase heart rate and constrict blood vessels, leading to elevated blood pressure. The effect varies significantly from person to person. Some patients experience no blood pressure changes whatsoever, others see modest increases, and some experience significant elevations that require intervention. If you take an SNRI antidepressant and you have noticed your blood pressure climbing, please do not stop your medication abruptly. Instead, schedule a conversation with your prescribing physician. Alternative antidepressants exist that may have less impact on blood pressure. The goal is finding the right treatment for your mental health that also respects your cardiovascular needs. This is absolutely achievable with proper medical guidance. There is one more category I need to address, and it may be the most surprising of all. Supplements. Natural products that people take specifically because they believe these products are safer than pharmaceutical medications. The supplement industry generates billions of dollars annually, largely on the promise of natural health solutions. But natural does not automatically mean safe, and several popular supplements can raise blood pressure significantly. Licorice root, often found in herbal teas and traditional remedies, contains a compound that causes your body to retain sodium and lose potassium. This combination can elevate blood pressure substantially. Ginseng, marketed for energy and vitality, has been associated with blood pressure increases in some users. High-dose vitamin D supplementation, when it leads to excessive blood calcium levels, can contribute to arterial stiffness and elevated pressure. And certain herbal weight loss products contain stimulants that act similarly to the decongestants we discussed earlier. The danger with supplements is that most people never mention them to their doctors. They do not consider them real medications. They assume that because something is sold in a health food store, it must be inherently safe. This assumption can be dangerous. Every substance you put in your body has the potential to interact with your physiology and your other medications in ways you might not anticipate. So what should you do with all of this information? First, conduct a complete inventory of everything you take. Prescription medications, over-the-counter drugs, vitamins, supplements, herbal products, write them all down. Second, bring this list to your next doctor appointment. Show it to your physician and ask specifically about blood pressure effects. Third, never assume that something is safe simply because it does not require a prescription. Fourth, if your blood pressure has become difficult to control, work with your doctor to systematically evaluate whether any medication or supplement might be contributing. The relationship between medications and blood pressure is complex and deeply personal. What raises one person's pressure might have no effect on another. But armed with awareness and the right questions, you can work with your healthcare team to identify hidden contributors and develop a plan that addresses all of your health needs without creating new problems in the process. Your blood pressure matters enormously. It affects your risk of heart attack, stroke, kidney disease, and cognitive decline. Every point counts, especially as you age. Do not let a pill you trusted undermine the hard work you are doing to stay healthy. Knowledge is the first step toward control, and control is the foundation of a longer, healthier life. Share your experiences in the comments below. What surprised you most about this information? And please remember, always discuss any changes to your medications with your doctor before taking action. That partnership between informed patient and attentive physician is where the best health outcomes begin.